Please proceed.
Yep. So welcome everyone to the official launch of Citrus AI Clinic Assistant. It's lovely to have you all here with us today. My name is Nida and I'll be your host. Just going to give everyone a few more minutes to join before we go ahead and get started. So I'm sure we can all agree that artificial intelligence has become such a fundamental part of all of our lives. As a medical student myself, I can definitely assure you that it has become such an integral part of my learning inside the hospital and outside. I'm not quite sure how I studied before, to be honest. Artificial intelligence has revolutionized so many industries, and healthcare is one of them. So today's Citrus AI Clinic Assistant, it's an innovative software with the purpose to help reduce the doctor's administrative workload. So essentially that the doctor can be more focused and present on their interaction with the patient. And especially now, the doctors are so overburdened by administrative work that it can often cut into their interactions with the patient. And the goal of Clinic Assistant is to be able to give the doctor back to the patient and improve that interaction with the patient by not having to be boggled down with administrative work that can be done by AI. So AI Clinic Assistant has two parts to it, medical transcription as well as medical record analysis to help achieve this. Today we have with us the founder of Citrus AI to talk us through the functionality as well as his motivation behind designing it. Dr. Suhail Chughtai is an orthopedic surgeon with NHS and international experience. He is also an AI strategist, and he has had a keen interest in tech for several decades. Through this webinar, if you do have any questions, please do drop it in the chat box, and I believe Dr. Suhail will be having a Q&A at the end. So, Doctor, handing over to you now.
Thank you very much. I appreciate the introduction. Actually, this connects me to my past when I started working as a trainee in UK, when I saw my consultant dictating patient-doctor notes like consultation summaries. And he was at times going back and forward, and before the next patient come in, he had to finish his dictation. And I was always thinking that, is there a better way of recording this conversation and converting them into notes, and then the secretaries used to come back next day or day two or 3 days later to actually get things saved, and then there were some mistakes, go back again, and the notes were never really there for a week or so. So that was kind of itself an own administration, a job which had to finish besides doctor-patient consultation. So I kept thinking, when I became a consultant myself in this country, I thought that NHS doctors have, at least they're spending, if not more than 2/3, it's half their time on patient administration. Something when they're disconnected from the patient, something when they're not giving the care. When we studied medicine, the ethos was that its doctor is caring for the patient all the times when we get in touch with them. But here, the burden of administration, all the way I have seen, is actually a block between doctor and patient. So somehow patients felt less attended, and more so when we started calling them as service users in England. That was again the disconnected increased. So the ethos of medical profession is very important to be kept. Sorry, excuse me. The ethos of medical profession required to be kept alive. And the way to do was to develop a system, use the technology where doctor and patient are back to themselves. They are back to a connected mode. So one area was the doctor-patient communication, and then converting that into medical notes. That was one area. The other area was that a doctor has to look through the medical records to be well informed before they actually start looking at the patient, before they start making decisions. So here is my consultant or myself sitting in a clinic with big pile of records, and that big pile of records I cannot look through. That's paper records I'm talking about. Then the medical records converted to EMR. So a bit faster, but again, you could search the key terms, but you cannot get the trends. And sometimes the searching cannot be accurate. So we wanted a system where artificial intelligence can actually help to make the doctor more informed before the patient gets into the room. So what my motivation has been to help, first of all, my clinic problems, like reduce the admin workload, spend more time with the patients, and then if that helps me, I wanted to share with my colleagues. So I've attempted to do the same, and I want to share that with you. I'm very excited to share that what I've done in the terms of software. And this whole process came into being by intense thinking. And then I met my partner, technical partner in this game, in this whole process, in this journey, Umesh Khandelwal. And he's the gentleman who helped me to provide the technical backup. I myself have some digital health background. For the last 20 years, I've been working and designing software, but I wanted really solid technical help. So Umesh Khandelwal came together, and my company, ML Professionals, giving healthcare services, and his company giving technical services, they joined hands together. So that was when we started creating a software. Now the software came to market, or we're ready to talk to you. We wanted someone to deliver it to you. So we had a third partner, Sohail Server, running Capris Consulting, the marketing automation team. So we are now in the term kind of self-sufficient within ourselves to create a team of in domain expertise, technical development, and go-to-market strategy. So this is the time I thought I want to share my attempt with you and see what helped me. Can that help you as well? So here I am today talking about Citrus AI Clinic Assistant. And in the next few minutes, I want to take you through this process, that how it can help you when the patient is in the lounge, not in the clinic. So you can search the records and talk to the records. Once the patient comes into your clinic, then you can press the start button and the whole conversation will be converted into meaningful notes. So when I say meaningful notes, I mean that you can push that conversation into structured SOAP notes, structured histories, or even a templated record, like you want to drive your consultation into certain template, like medical legal consultations, like psychiatric consultations, cardiac consultations. So whatever the conversation you're having with the patient can actually be driven into structured notes. So that is where we can take help of AI and get along very well. So I want to share what is the attempt looking like. So this is a screen of Citrus AI Clinic Assistant, and I've logged in. I just want to now upload, while the patient is sitting outside in the lobby, patient has given access to the medical records in the form of PDF files, or we are connected to the hospital medical records. In both situations, now I can talk to the medical records. So in the first situation, where we have patient giving us the medical records, I want to share that with you, because right now we have not connected it to a live hospital record system, but this provision exists. So I want to now upload a file here, which I've just brought in here. Under the GDPR regulation, we have to obtain the patient's consent and register that I've taken the patient's consent and then upload. So I have just uploaded patient's medical record while the patient is waiting in the lobby, and I want to be more informed about it. So this is going to the server, getting recognized, and I have now 4 options. I can do a general short summary of the document, a detailed summary, or I can draw specific information, or I can simply chat with the document. Let me get there first, and I want a simple summary of this document. So in this example, this 31-page document has been outputted as 1 or 2 pages, and I can quickly glance on it. And if that is not enough, I can go back to the prompts page and go to the general detailed summary. So this will be a little more detailed with description included. And the very important point I want to make here is that the chances of hallucination or thinking itself without information being there is hardly negligible. The reason is that whatever information we are presenting to the large language model, it's working in that boundary. It's not comparing it with any document. even we can delete this document very soon. And I will show you in a moment how can we anonymize this document before we upload it. So this is the summary which I've got. Now, if that is not enough, I can go to exact information and I can say, look, I want, for example, this patient's accident report. This patient had an accident, and I want to say, well, road traffic accident. And I want to say, please describe the accident patient faced, and say proceed, and it pulls out the information which I would have taken time to get into. The claimant was a front seat passenger in Vauxhall Corsa, happened near in Shigwell, London, and this information is well categorized and summarized. Now let's talk to the document and say chat with the document and say proceed. Now here you are. You can talk to the document in any way, and I just see if my mic, although I'm sharing my mic with the live platform, but I think I might be able to talk to the document and co-share the mic. Can you please give me information about this patient's car accident and tell me whether the patient was wearing a seatbelt or not? So now, according to the information provided on page 5, patient, which is anonymized, was involved in a road traffic accident as a car passenger. He was a front seat passenger, and then my question was about the seat belt. And then it's not clear. The patient was wearing a seat belt. So that's the very specific information I wanted. Let's get some more questions. So what was the position, what was the speed of the car the patient was in? So it was 40 miles an hour. Okay. What injuries, physical injuries, were sustained by the patient in this car accident? So it gives me a list of the physical injuries, not the psychological injuries. So in this case, it tells me that on the 16th of September 2023, this patient suffered the following injuries: neck, lower back, bilateral shoulder pain, left ankle pain, and chest pain. And yeah, I can cross-verify that. I can check whether this is hallucinating, making it up, which is a very common blame given to the large language models. But here they are. You can tell actually this patient had these injuries. So you can ask more questions. For example, did the patient suffer from any psychological trauma after this accident? Oh yes, it tells me the patient has a short-term shock, which took about 2 weeks to resolve, and then the situational anxiety about the car accident. Let's go further. Did the patient get any physiotherapy for the treatment? Yeah, so it also tells me that the patient was recommended to undergo physiotherapy, and patient had not received any rehabilitative treatment until the date of the report. So in this way, you can keep going and ask as many questions as you want. The important point which I want to make here today is that the information you've uploaded, that is the only information ChatGPT or any other large language model we've connected on the back end is looking at. It's not, I've made sure that the boundary is defined, that what you're looking at is what you're giving to the LLM. So that way the chances of error are minimized, and that is going to be the basis of the information extraction, so that we are not getting the information which is made up by the large language model on its own. So that is one thing we can do. In fact, if you go to export button, let's say we want to put this information back into the EMR, we can export this thing, and we can see the whole output, and we can even format it. We can change the headings, change the colors. And the interesting part, which I thought was of value, I can have information cropped, and I can save it in any segment by pressing Control V and paste. So it's copied, and I can save it. And now I can output it as a PDF or docs file, and then I can take a look at this file. It is already saved, and this can go back to the electronic medical record system, or can stay with the patient as one of the output records we have made today. But mind you, this patient is still outside in the lobby or sitting next to me, but we haven't started the consultation. So this is the part where I'm becoming informed about the patient's condition. And that is where it's so easy and quick. Imagine if I had to take this information from, let's say, 200 pages of patient, and I wanted very specific information. So this searching cannot be just keywords based. It can be subjective or contextual or trends. You can ask the medical records that, can you give me the trends of blood sugar, patient's blood sugar in the last 6 months, because I'm going to operate this patient next week. So it will give you the trends that the blood sugar is going up and down. And if you want to be specific, you can say, can you give me the list? Can you list out the last 6 blood sugar readings from the set of medical records? So both objective, keywords based, and subjective, trend based or context based searching can be done from the given set of records. And that is important. We are not going outside the boundary of that domain. So hallucination, giving false information, inaccuracies are very, very minimal. And people ask me that, what's the difference between going up on ChatGPT and going through a specific boundary? And this is one difference which I suggest, and I will explain this more. So this is one way of managing this. Now, let's look at the other angle of things. I can actually this is the medical record I uploaded. This will be automatically deleted from here in 14 days. Or I can delete it right now. And I can, if the patient requests, the doctor, can you please delete my records? I can delete it. I can put the patient's email address and then submit it. The confirmation will go to the patient that we have deleted your medical records. Nothing is saved on our system. And that is important for giving respect to GDPR compliance in the country. So let's go back again and see if I upload many files. And now this scenario is slightly different. I'm uploading 5 or 6 files, for example, patients, 5 or 6 patient case notes. And I want to find out that what is the common issue here. I want to do a study of 5 or 6 cases. I've got 5 or 6 research papers. I want to get the commonality out of them. And it's like medical research or academic research, case notes or academic papers. So you can put the papers up here and then actually talk to the papers individually or together as well. For example, so I've already uploaded and I'm going into those papers. And now I can ask questions. I can say, let me talk to the medical record, and I can say, what has been the common accident in all these 5 cases? So now it is giving me the list of all these accidents, case by case, and the road traffic accident seems to be the commonest out of all 5 cases so far. The rest were cyclists or bus passenger, and there were 2 road traffic accidents. Then I can ask, what has been the commonest injury sustained in this accident as far as the physical injuries are concerned? Now it goes along and it gives me the list of injuries, and you can see that the neck pain and shoulder pain and is listed all of the injuries here. And then you can say, did any of the patient get physiotherapy after injury? It tells me here is information, patient 006, physiotherapy treatment was sourced via private arrangement 5 occasions, and then you can even check it. That yes, here it is. This patient physiotherapy was given to 5 occasions. So this is out of all these 5 documents, 140 pages. I can quickly reach the context, the trend, the key information, and that helps me move along. This is for research. This is for analysis. This is for retrospective audit. You name it, and AI is there in this way to help you. And I feel that this has saved me a lot of time in doing my research in orthopedic and medical legal cases. So there's one more thing I want to show you before I shift to the next phase. Let's say if you get many files, but they have the same type of material. For example, 6 or 7 pathology reports, 10 or 11 physiotherapy letters, 6 or 7 radiology reports. How to summarize them, how to see the history of them together, because they're multiple pages and you want to see a summary. So here is you go to this radiology reports part here. I've uploaded them. These are all the radiology reports here. Different radiology reports here. And I'm going to now talk to them. I'm going to say, please summarize the radiology reports properly. So all these radiology reports are summarized. I could have taken at least 4 or 5 minutes to look at them and get this information out, but now I can see them very clearly and straightforward. Now I can say, tell me about the Lisfranc injury the patient sustained. Now it tells me that the patient sustained Lisfranc injury, and the X-ray showed that the joint was normal actually, so there was no injury of Lisfranc. Now I want to show you something interesting here. This information is being extracted from the actual information we provided. But if I ask something from outside, for example, I ask him, can you describe what Lisfranc injury is? Now, it does not describe Lisfranc injury because, as I mentioned before, it's not looking outside. It's looking inside. It's looking in the information you've given it. That's one proof. If this was looking at the information outside, do you think ChatGPT or any large language model doesn't know what Lisfranc injury is? And that is why it will not hallucinate. And that is something I've worked very hard on. My team has been supporting a lot. They have worked very much on that. We took a lot of time to really define this part, and I'm glad it is working. So let's get out of this now, and I want to show you one more feature before we go to transcription part. I want to show you how I anonymize patient records. If I upload one patient here, I say I've obtained the consent, and I change the patient name from this name. This is the patient's name. I change it to anonymized name. So I want the patient's name to appear like this. Now, this is an important point. The information we are giving to large language model will be anonymized. That information will not be available to large language model. Let's take a look. So this is being optically recognized and anonymized together. And now we have anonymized the patient. Let's go for summarization. Let's just check one information out and see whether it says anonymized or not. Did this patient sustain any car accident? Yeah, so see that patient anonymized information. So that is what the large language model, ChatGPT or anyone we use. We have 6 or 7 connected, but 3 of them we use more frequently, depending on what is your requirement. So this is where it has anonymized the information, what we ask it to. And that is what I thought is very safe for the patients. So now let's delete that part and let's go to the transcription part. So now the patient has come from the lounge into your clinic. The patient is sitting next to you. again, as I said before, I can't just emphasize it enough that doctor, the moment you take your eyes off the patient onto the computer, you break the communication, and you do it multiple times. You've broken a lot of connection with the patient. Your advice has technical value. The empathetic value, you haven't had time to build up. You haven't had time to connect with the patient, to give an advice which is more than technical. And that always intrigued me, that can I do something to really change it? And I'm glad that it's possible now through the generative AI. And I'm glad I have such a team who can actually work on the concept I provided. And let's take a look. So the patient is now with me. I have three options. I can record this consultation, and I can upload later in the evening and get the results, pre-recorded audios. I can have a live consultation recorded and streamed instantly, and whatever is being listened will be deleted instantly as well, and I'll show you that in a minute. Or I can go into a template of my report and start recording according to my template. So I can speak into different headings. So I can go from one heading to the next heading and speak, one heading to the next heading and speak. So when the output comes out, it will be very structured and very categorized. But even without that template, it can still be structured, which I'll show you right now. Let's start a new consultation. And this will be, normally it will be done on a mobile phone. I am showing it on the screen here, but actually it will be done on the mobile phone. And in this case, I'm using the desktop for kind of display. So here I start, but I have to say I have to take the consent of the patient for recording the consultation. Once you take that, you can press this button. I'm just going to take a minute to record something. I'm assuming that the patient has left the room, and I'm now dictating my notes. Hi, I've seen Samantha William today, who is a 47 years old lady who actually had a stumble in a superstore while she was trying to go down and pick something from the shelf. She felt right knee pain, which was moderate at the time, but as she reached home, the pain had increased to 9 out of 10 by the evening, and she also noticed some swelling. That pain carried on for 2 weeks, and now she's sitting with me and describing that today. The pain had accompanied features like swelling and redness of the knee, and the pain was improved by ice packing or resting, and it got worse when she used to go on steps or she walks for 10 minutes. She has only tried ice packing and no painkillers as yet. This patient I have examined today, generally she walks without a limp, although she walks very slow, and she's generally normally built up, and I think the body mass index should be within the reasonable limits. On the examination of the right knee, it is a bit puffy, a bit swollen, and I also see some redness on the top end. The inspection has nothing more than just swelling, whereas palpation reveals that the medial compartment of the knee is tender. The range of movement testing shows that she's able to flex to full and extend to full, but she feels pain at the extreme of the range. She's able to fully weight bear, and any of the special tests do not reveal any cruciate or collateral ligament issue, except the moment you stretch medial side, the collateral, although stable, but was painful. So I did an X-ray of the knee. There was no fracture, so I thought it was a medial collateral ligament strain. I've arranged her to go on Brufen 400 milligram twice a day, and then she will come back to me in 2 weeks' time. My plan is to do an MRI scan if she's not better by 2 weeks' time. So this is what I will do once the patient leaves, and this is being transcribed immediately. Now, I just want to point out this here. This is being transcribed, and there is nothing recorded. The recording is gone. It's instant transcription. And now you can summarize that. So the summary will be methodical. The summary will be meaningful note. This is based on the prompt we set in the background, and the summary shows that the patient has history of right knee pain following a stumbled on a store, right knee pain, 9 out of 10 by evening, 2 weeks' time, now with swelling and pain improved with ice and rest, etc. Examination findings: slow gait, right knee puffy, swollen, red, medial compartment of knee tender on palpation, full flexion extension, with pain at extremes of range, weight bearing tolerated, medial side painful upon stretching, working diagnosis, medial collateral ligament stable but inflamed, but strained. So my management was proofing and then x-rays. Now, if I feel the spellings are wrong, I can always go back to transcription and correct the spellings of anything which I feel has not been well picked up. For example, Brufen here. See, it was not read well, but it was written as Broof, but actually it went as Brufen when the whole thing was transcribed. So in that case, we can now go to SOAP notes and check how detailed the summary is there. The SOAP notes are the standard ways of recording patient-doctor communication and has been a kind of used in many countries, although it may not apply to certain specialties. But here you can see the plan and the assessment and the objective. All the things have been pushed into the right compartments. The segments of conversation AI has pushed into right compartments. And then you can, if you want to add something to it, you can still add something. For example, you can say the MRI scan should be preceded by another trial of physiotherapy. So this is where you can amend the notes and go back to summary and say, include the comments and now regenerate. So MRI scan planned after a trial of physiotherapy. What I just said has been included. So you can add up and you can now download this. This can go back to EMR, or you can copy it back to the EMR if you're connected to already the hospital system. Or you can download as a PDF file and then send it back to the patient as well or to the hospital. So this is a very simple way of transcribing doctor-patient communication. In many countries, electronic medical record systems are not developed because there is no way they can effectively convert doctor-patient communication into notes. But here, in those countries where electronic medical record systems are not well developed, this is a hope. I think some of the questions I've seen, people have been asking questions here, and there was a question that can this be some other language? So yes, we are developing other languages, and then it can work for example, this question. There's no option for different Indian languages. There would be options for many languages, Arabic, Turkish, and so that means doctor-patient communication can be in any language. It will be transferred into English while it's being saved. So one thing more I want to show you that it has a feature of excluding the non-medical conversation. I actually forgot to show you that today. In my last demo, I did that I asked for coffee, I asked to shut the door, and that part was excluded categorically from the output. So any conversation which is not medical will be excluded from the output. So let's go back and see what else we can do. For example, in this one, you've recorded the conversations and now you've gone, patient is gone, the clinic is finished, and now you're uploading the recordings. Here is one recorded version which is uploaded. I've uploaded a MP3 file, and this has been transcribed. I won't quickly do it again together. So I will upload a file here, and now it is transcribing the doctor-patient communication which has been recorded. And it takes a little while, maybe a few seconds, before the results drop in here, and here are the results. And then you can summarize these into proper summaries as well, or SOAP notes. And then you can add and remove whatever you want from this. So another way of doing this is going through templates. For example, if you start with a template, you can pick a template. If you're a medical legal assessor, you can pick a medical legal template and start recording information here. You can take a history, and you can just go into tab by tab and start putting information. So this is the way people do it. I want to show you one templated summary I've already done earlier. This one, yeah. So I connected tab into tab, and I recorded. I just spoke to the patient. It made bullet points itself. And now this will be output in the form of a report like this. This is a structured template, and cardiology templates, psychiatry templates, and you can create a template. You can use industry-specific template and all that. So this is something which I am very excited to share more and more. We will be doing more webinars, more templates, and more features will be added. This is phase 1, by the way. I am keen to help the medical healthcare industry in the way that my problems are that I want to connect with the patient, but administration work is in the way. I want to find a way where I'm back with the patient. AI is there to help us. It's only we have to use it the way it should be used in healthcare. So this is my attempt today. It has solved many of my problems. I use this regularly in my clinics. I feel that my clinics are finishing in time. I have very structured information available towards the end of the clinic. Most of all, I'm very connected to my patients. I'm talking to my patients eye to eye. I'm not kind of looking at the things, the papers and computer screens and all that. This is what gives a lot of satisfaction to patients. They say thank you. They say nice to see you. They're happy. That brings a smile. They thought they're listened to. They're heard. They're seen. They're seen at the examined properly. You have to develop certain techniques, like when you examine a patient on this particular model, you need to speak that I'm examining this patient. The abduction is this degree, flexion is this degree. So the software listens to this as well. So a little bit of adjustment you need to do so that the system listens and cares for you. So this is the ecosystem I'm designing at the moment. I want to just share one thing more with you today. Before the patient comes to your clinic, there is an audio chatbot where patient's history is taken. That history comes to you before the patient comes in the clinic. Then the patient is in the lobby. Then you've got medical record analyzer. You understand the patient's problem more before you call the patient in. Now the patient is with you. When the patient is with you, you are able to now record that conversation, convert that into meaningful notes by pressing the start button. All of that would mean what? The doctor-patient consultation is going to be totally from the top, from the very first day to the end of the consultation, is going to be paperless. It's going to be accurate. It's going to be admin-less as well. Doctor, patient are always in touch with each other. And that is my aim. And I hope that you find this of value. And it's a teamwork. Teamwork is inwards, like my team development team. And now people who are watching and listening to that can also be part of the team. They can advise me. They can guide me. What I've missed, what I've not done properly, where I need some help. And I'm very open to discussion. And I really feel that if you are able to, if you want to join this, if you want to do it, just use this get access button and make your account, which is, you don't have to pay. Just make your account and start using it and start testing it and see if that suits you. And let me know if I have not done something properly. Your feedback is very important to me. I really want you to sign up, check it out. As I said, you don't have to do anything here. There's nothing, no payment required. You need to just start using it and then find that is it something that's solving the problems or not. I want to know from you that how could I make it better for all of us, all the healthcare fraternity. And I'm glad that you have joined today. Let me just take some questions. I have some questions here. Let me pick one. The people who have asked me, for example, this question. Dr. Deshpande, most of the voice to text software not working up to mark. That's a comment. Thank you. And your feedback is valuable. And then we have this. There's no option. I've already addressed that. Can AI also listen and analyze what patient tells the doctor as a doctor assistant? Now, this is the clinical decision support system, which is the next stage. which means that we are going to add that component where a differential diagnosis can be suggested to the doctor. That we have not done yet. As I mentioned before, the ChatGPT is looking at the information which we have provided to it, and you can delete that as well. So there is hardly any chance, if very little, of any hallucination. But once we go to clinical decision support systems, like differential diagnosis being offered to the doctor based on doctor-patient communication, that's the next level. We are still working on that, and I'm finding a safe way to be able to do so. But thank you for your question. Lakhan Maske asking this question: is there any feature for communication between a doctor and patient during OPD consultation and for generating an EMR accordingly? Well, this conversation can be done online as well. You probably know, or many of you have known me before. I've been designing telehealth software for the last maybe 15 years or so. And in COVID, it was very, during COVID time, it was very predominant. So I'm putting this software on telemedicine software as well, so that whatever doctor-patient communication is done through remote system can also go into a system of EMR where this can be saved as meaningful notes. So if that is what your question is, yes, it can do so. Then we have Sohail Server. He's a marketing engineer. He's the business director. He's helping us to find that you can click here and start using it. Thank you, Sohail. Now it's saying that Mr. Deshpande said, yes, it is. Is it good? It is good for doctor in case he's not looking in the lab report. This is something which helps the doctor so much to look to multiple 10 or 12 lab reports and then see the trend. Human memory or working memory or concentration can fail or can work under par. But if you have a software to help you, like your extension of your working memory, it can give you the trends, the slopes, the graphs, and all that. So there's one more comment. Rajneesh Nirola, who's one of the advisors as well. This will be a game-changing classic clinical system to allow doctors to focus on their patient efficiently with care and empathy. And I totally agree with that. And I think we are in this journey, we are going to be at a place where doctor and patient are back together. They have been disconnected through the burden of admin, and that's enough. With technology, we are able to unite the doctor with the patient in the true sense of the ethos of profession. And there's one more. In case the doctor checked more than 50 patients in 2 hours, how will this help? Well, I mean, if the doctor has a lot of patients, then this can force the time between two patients will decrease. The time from one patient to a second patient will decrease. That means the notes, there's no time required to really dictate the notes. Again, the time to look into the notes to get ready for the patient will also be decreased. And that is, again, a second point where you can increase the number of your patients in fixed time and still have quality work. So I'm very happy that we have really gone through that. Again, I leave this stage with the option that if you want to sign up, try this out, and let me know how you feel. This is important for us to help the healthcare profession. This has been based on my experiences, but my experience is not a complete experience. There could be other variations, other areas where I might be able to really patch up this software. So yes, come back to us, let us know, and I'm very open to communication and discussions on that. But today, this program ends at this note, that if the doctor and patient communicate, the technical advice the doctor gives to the patient is far more valuable, far more empathetic, and that is where we are going to win. Thank you very much. Bye for now.